Hello and welcome back to another episode of my podcast, The Pocket Stylist. I'm Lisa Talbot and today I am joined, fresh from London Fashion Week, by the wonderful Lauren, my wonderful, wonderful hair expert. Good morning, how are you?
Morning, Lisa. I'm fine, thank you.
You have had a very exciting time, haven't you, over the past
I
week or so?
Very busy, very crazy, but I look back and think, wow, what an experience.
Exactly, and you are off somewhere else, aren't you? Are you allowed
I
to
am
say where you're
next
going?
week. Keep an eye on my social media and you will find out where I'm going. Somewhere very
Absolutely.
exciting, but I can't say.
It is very exciting. Anyway, today's podcast, I asked Lauren to come and join me. So for many of you, if you're in my world and you're on my socials, you will know that I have been working very, very strongly with the cancer charity, Look Good, Feel Better. We ran, and well, I was very, very privileged to be able to write and develop in partnership with Look Good, Feel Better, the face-to-face style workshops. We ran 2 pilot sessions in Glasgow, which were amazing. And we ran 2 pilot sessions in Oxford Street. All of them ran in the John Lewis partnerships because it is in collaboration with John Lewis. But when we were doing the pilots, obviously I talked about style and fashion and colour and body shape, etc., whilst ladies are going through their cancer journey. But one of the areas that came up time and time again was all about hair. And it was about hair loss, how ladies feel very different when hair regrows, etc., etc. So what I have done today, I kindly asked Lauren to come on and chat to us about her experience working with some cancer patients and their hair, but also to be able to give you guys real hints and tips if you are yourself going through that journey or you know somebody else who is. So, Lauren, just highlight for the listeners and for those watching on YouTube as well, because our podcast is going out on YouTube, just highlight some of the topics, because we kind of worked out 4 topics, didn't we, that we were going to cover today?
Yes, we did. We said we're going to go through colour, how your hair grows, how your hair can potentially grow back, because it will grow back differently to what you're currently experiencing.
Yeah.
And how to talk to your hairdresser as well about getting your hair cut when you are first diagnosed with cancer. And there's lots of different ways that you can, we'll go through it in a minute, but there's lots of different ways that you can deal with your hair. You know, it's not the end of the world, it's a temporary situation. And I always say to clients, if you lose your hair, that means your medicine's working.
Yeah, and that, you know, that's a really lovely way to look at it. And what came up in the pilot workshops was this change of identity. Ladies felt very different because obviously they went through the hair loss journey, so they went through that bit. But then they said, you know, when their hair grew back, it grew back in different textures, it grew back different colours, and then they felt again a little bit different to the person they once were. So, you know, we can talk about the style, etc. with it. So let's take it right the way back. So when ladies, you know, are diagnosed with cancer, I think that the first worrying thing is I'm going to lose my hair. Talk me through what we were talking about before and share some insights as well about how ladies could cope with that kind of hair that starts to change through treatment, and about, you know, the worry of hair loss. They don't potentially have to get to that point, do they? And this is where we were talking about there's different stages. Let's start there and then we'll build on as the hair grows back, and we'll go through that bit.
Okay, so I've worked with, I'd say, between 12 and 15 clients that have gone through cancer. Out of them, I've had 2 that have not lost their hair. And the reason they've not lost it is because they've had a treatment called the cold cap.
Okay.
Now, and for anyone that's listening or watching that is going through cancer, you need to speak to your consultant about this, because I'm not a trained expert on dealing with cancer. I can only talk to you from a hair point of view about it. So you can have the cold cap, that is one option. But I know a lot of people have tried it and it's really not for them. So if you can't have that, don't think to yourself, oh, I failed because I can't have the cold cap. And as I've said before, if you're having treatment and you're losing your hair, your medicine is working. because that's a side effect of it. So as much as it can be distressing, hair does grow back. It's not the end of the world. I've had clients that have had cancer or are on a long-term medication to control it, and they've got their hair back and they are loving life again. So don't ever look at it as it is the end. Now, in the experience I've had with working with clients that have had cancer and the treatment, when they go for stage 1 of their chemotherapy, generally their hair doesn't really come out. So from you being diagnosed to going to the treatment of phase 1, you, depending on your time schedule, but if you've got a really good rapport with your hairdresser, go in and just say, look, can I just book a consultation? I'm going through a bit of a difficult period. I need to talk about something. And sit down and just say, look, it needs to be, can I come in at a quieter time when the salon's a bit more private? And just say to them, look, I have got cancer and this is the treatment plan for me. And work out a hair plan for your hair. So it could be that the first, if your hair's sort of on your collarbone, the first, you have it cut in 3 weeks' time and it goes to your cheekbone. So your jawline, that's the first one. And then you have your first set of chemotherapy and your hair doesn't really fall out. So after that, you might go a little bit shorter, maybe to the bottom of your earlobes. And so you can still love yourself, but your hair's just getting shorter gradually rather than, there's no need, unless you particularly want to. But I have never taken a set of clippers to a man or a woman's hair that's experiencing hair loss and shaved their head, okay? Not unless they've wanted me to, okay? So you don't, it's not compulsory, because I think women, especially women, they think, oh my hair's going, and then they just have this image of someone shaving their head. It hasn't got to be that way.
So actually what you're saying then, Lauren, is you're taking the hair shorter. Yeah. So almost what you're doing is you're changing your style. So you're going shorter to kind of compensate with the treatment, but also to almost so you still feel like you. So what you're doing is you're changing whatever length of hair you have to shorter. And doing it that way.
Think Dame Judi Dench. That it might be that you end up with your hair as short as that. So by the time you're having stage 2 or 3 of your treatment, and your hair probably will start falling out. It's so short that you might not even notice, especially if you're lighter in hair colour, you're probably not going to notice it falling out. Unfortunately, yes, you do need to get your hair cut short. And I have had a client in particular that didn't get her hair cut short, and it came out in chunks, and it was very distressing because she had long hair. And I'd given her the advice, but I can only advise.
Exactly.
And so just anyone that's listening or watching, it's really, really strongly recommended from a hair point of view and for your psychological, your mental health as well. To just slowly go shorter. Okay. And then that whole thing of your hair coming out, it's upsetting, but it won't be as bad as if you've got long hair and there's, huge amounts of it piling up on the floor. Yeah.
It's really interesting. Well, because we say about hair, don't we? Hair is our kind of crowning glory, and it's the thing sometimes that makes us feel like us, is our hair. So I loved what you said earlier on, it's a temporary, hair will grow back, it's temporary. So
nothing's permanent, nothing is permanent. Unfortunately, if you've got an illness, it could be permanent. There's thousands of treatments out there now that can help control things. So we have to try and find the positive.
Yeah, I have to say there were, a few ladies within the pilot sessions who had this amazing pixie cut, like you said. They looked stunning. They absolutely looked stunning. Now we can say, you look stunning. However, it's about how these ladies are feeling. So I think the change of identity, because obviously they see somebody looking back at them in a mirror who maybe isn't the person that they're used to seeing. So talk me through the next bit, because obviously when the hair grows back, a couple of things that the lady said, there was two kind of sides of it. One, it grew back different texture, but not only that, it grew back a different colour. And this is where a couple of the ladies, when we were talking, were saying, it just doesn't look like me because, so let's break it down. Should we talk first about it comes back a different colour?
Yes.
So go on, talk me through that bit.
Your hair will, not everybody, but the ones I've experienced, or the ones I've worked with, do come back a different colour. We don't know why, but it's probably, and it's probably because of all the maybe the treatment you've had, and you know, hair, like it does it will change you. So it comes back a different colour, but embrace your colour. And with all this, one thing I will say, with all the changes, I can talk to you from a hair point of view, but this is where me and Lisa team up really well, because you need to speak to somebody like Lisa who can advise you on your style. Now, when your hair is short, you can accessorize madly with it. You can wear hairbands, you can wear a hat, you can put a clip in your hair. You can do lots of different things to make it, you know, more feel like you. You can, we'll go on to colour in a minute, but you can colour your hair as well.
So let me pick you up on that one. That's really interesting, because one of the ladies said to me, she said, now it's grown back grey. She said, I feel so old. She said, when I look in the mirror. And this is, you know, this is why I wanted to do this podcast, because so is there any kind of rule of thumb with regards to when you can colour your hair, or the products best to use? Is there anything like that?
Right, all the advice I will give you in this section, two things. You need to consult with your consultant and say to them, can I have my hair coloured?
Yeah, okay.
Second thing you need to do is make sure you have a skin test. Even if you've been going to the same hairdressers since you were 16 years old and you're 85. Yeah, your hormones change all the time.
Okay.
So you should always re-skin test through pregnancy or any illness, because your hormones change. So yes, you can have your hair coloured. Now, I'll be super honest with you, there's no point in having your hair coloured if you're going through treatment still, because it's just going to fall out. So what you need to do is wait until they say, right, we've 6 months break, or we're going to give you a break now, or this is it, because you're going to be on this type of thing and this is going to control your cancer, and or your cancer's cleared up, great, don't need to see you anymore, or until we start going into remission and all that. I won't go into details, but obviously they know what they're going to be doing with you. That's when you can have your hair coloured. Now, you can do a couple of things. For the ladies that you were saying that are grey and have got short hair and they just think, oh, it's not me, you can just go into a local Superdrug or somewhere like that and buy a coloured hair mousse, and you can just put that into your hair. It's temporary, so it will wash in, wash out. So you can pick any colour you want. I always say, when someone comes back after a cancer treatment, is there any colour you've always wanted to go? Because I can put it in now, because we're working from a blank canvas. I haven't got to work on previously coloured hair. So, where do you want to go in the colour spectrum? Because if you want to go purple, now's the time to do it.
Yeah.
So you can use that. You can also use colour conditioner as well. And again, they're available from the high street. If you go into a salon, if you're used to having highlights, when your hair first grows back, you can't have them. And the only reason you can't have them is because your hair's too short. So all you need to do is just work on growing your hair. And with that, there's two products you can use. You can use a brand called Glower, which I've spoken on here about before.
That's the vitamins, isn't it?
Yeah, they're for hair, skin and nails, and they're organic. So they will help your hair, skin and nails to grow. There's also another brand called Nioxin. Now, Nioxin is external, so it's a shampoo, conditioner, and there's different steps to it depending on how far you are in your journey of getting your hair to come back. So stage 1 consists of a shampoo, conditioner and a mousse. Now, for the product to work, you need to use all three every single time you wash your hair. With part 3 of that product, which is the mousse, you need to apply the mousse to your scalp every single day, even if you're not washing your hair. And you massage it into the scalp with the pads of your fingers. And if you're watching it on YouTube, you'll see me do it, but you just move the pads of your fingers around your hair to stimulate the hair growth, okay? Now, when you are doing this, I really strongly suggest you take progress pictures. Now, you take progress pictures on day 1 and then every 30 days afterwards, because you're going to see yourself every single day and go, my hair's not growing back. My hair's not growing back. None of this is going to happen overnight. It takes time, but you can trust me. I've got clients that have no hair. They've now got a bob, and their bob's sitting on their collarbone. So it will come back. It takes time. You've got to have patience.
Yeah. For the ladies that are listening, please don't worry about trying to rewind and write that down. I will put both those names with some links in the show notes.
Show notes.
Yeah, we'll put it in the show notes so that you've got it. So don't worry. That's really good advice, Lauren, isn't it? Before kind of the progress, because sometimes you don't see it, do you? And then you could look in 2 weeks.
We see ourselves every day. Yeah. It's so hard to notice a change on yourself.
Yeah, I think it is, isn't it? One of the things I was just, while you're talking, actually, I was thinking about my mother-in-law because my mother-in-law went through cancer treatment and she went through
Yeah.
stem cell transplants, two of them. And when her hair grew back, it grew because she was auburn. I never knew her as
Okay.
auburn, so I knew her. She'd gone kind of grey by the time I met my husband 25 years ago. But when her hair grew back, it grew back this most amazing iron grey, but literally like ringlets. It
Yeah.
was the tightest. She almost looked like she had this real, almost carpet of ringlets on her
Yeah.
hair. So some ladies, again, when we spoke to them in the pilot sessions, they said it's grown back a different texture as well. Have you got any hints and tips on how to, or products as well that could help with that? Because one lady said, she said it's so unruly. She said, I don't know what to do with it as it's growing.
Yeah. I would suggest that you go to your hairdresser and get them to teach you how to blow dry your new hair. And I have spoken about this before in the podcast. Video on your personal phone,
Yeah.
your hairdresser blow drying your hair, so you can watch them when you go home. That's tip number one. If you find in your hair's kind of, especially if it's curly, sometimes it can be a bit drier.
Okay.
You've got things that you can use. I mean, the brand I work with is Unite, so you can use. We've got U oil, which you can put into your hair that keeps it nice and hydrated. It adds vitamins and shine
Okay.
back into your hair. And if your scalp's quite, dry and things like that, you can add shea butter is really good as well. You can use it as a treatment. So you would wash your hair, put the shea butter on it, and then leave it in a towel for half an hour, and then rinse it off, and it just keeps it nice and soft for you.
So Lauren, could you use that shea butter obviously as the hair's growing back? Because some of the, I'm just thinking that as we're chatting, another lady said when it grew back, it itched. So is that, I'm
Yeah.
assuming, is like the dryness in the scalp that
It
the
is the
shea
dryness in the
butter could
scalp can
help.
be itchy, yeah, definitely. I mean, I always think, again, it's kind of a good sign that it's itchy because it's growing through.
Yeah,
I always remember as a child, if you fall over and then you have a bit of a cut and then it starts to itch, well, that's a good thing. So that's the skin healing back
yeah,
together and, making
yeah.
new skin. So that's your hair growing back because it's itchy. So I wouldn't look at it as a negative. It's a positive. I know it's a bit uncomfortable when it itches, but that means it's growing back, so that's a good sign. That means whatever you're doing is working, so continue to do that.
I think it is. I'm just, as we're chatting, I'm thinking of some of the things the lady said, and one lady was saying exactly that, she's got the hat and, but it itches. And so the things like the hints and tips we're giving are absolutely brilliant, and the colour
Yeah,
and all that type of thing. Some ladies, obviously, they don't like that in between stage of when it's
yeah,
growing back. So they used a wig. There was a couple of ladies
yeah,
in the pilot sessions. You've got a couple of recommendations, haven't you? Because I know you
yeah,
can get the wig situation via the NHS, but
yeah,
if you want to, there are others that you can kind of purchase as well, can't you? And we
yeah.
spoke about that earlier on.
So the late Trevor Sorby set up a company called My New Hair. No, sorry, New Hair, New You. That's the name of the
Okay.
brand. So when you go onto Google, you put in New Hair, New You. And he set up, it's not something I do personally at the moment, but they've got a team of designated salons, or you
Okay.
can go up to Trevor's salon yourself, and you're going to a quiet, I actually did it with my nan. You go into a quiet room, and the best time to go is as soon as you find out that you're going to have some chemotherapy treatment. And you're probably going to lose your hair as a side effect, because they can match your hair to how it is currently,
Oh, wow.
and also take some pictures with you of how your hair generally is, different angles, back, side, front. Haven't got to go and have a photo shoot or get someone to take the pictures. Just go through your phone, or if you've got physical pictures, take them with you, and they will match your hair to what you currently have. And then when the wig comes, it's easy to put on. It's like a a swimming cap, and
Yeah.
you just place it on your head, and then you can style it, and it's very similar to the ones the NHS have, but you just get a little bit more choice, and I personally, this is a personal view, feel the quality is a little bit better with the Hair New You wigs.
Price, do you know the kind of price range? I know we hadn't even asked about this.
We're starting at, I think, I would say you're looking a minimum around £90 to £100,
Okay.
kind of, depending on hair length, hair type, colour.
Yeah.
There's a whole array. That's a real vague guide price. It could be
No.
slightly less, it could be more. I
Yeah,
can't
yeah.
really.
And all of this, isn't it, is very much this podcast today is about everybody's different, everybody's
Yeah,
situation is
yeah,
different. So we're
yeah.
trying to kind of almost give a bit of a broad view that
I mean, yeah,
hopefully.
equally, I've got nothing. I've had clients that have got wigs off of Amazon and brought them into me, and I've cut them to make them look like theirs. You know, there's options for everybody.
Yeah, and
It's not one size fits all. You
no,
find
exactly.
what's right for you.
Yeah. And from my perspective, it's all about confidence. So this is all about confidence, that the clothes you wear, you know, because during the pilot session, so many ladies said, you know, my body shape's changed.
Yeah.
You know, I've had a mastectomy. I now don't have a bust because I'm waiting for my reconstruction surgery. So I've got some prosthetics, you know, all that type of thing.
Yeah.
And the reason for the hair is because so many ladies brought it up. And it was very much about, you know, lack of identity. And actually, I was thinking about you then when you were talking about the wig situation, to help and support those ladies who feel that lack of identity, that wig where they match it to you and you match it to the style, it helps you feel like you. But in another case, you know, if you want to and you feel confident enough, don't go down that road. But like we
No,
said,
it's not compulsory.
everybody's different. So I think what we're saying is, and I just want to recap, we've got the situation with the hair loss. You recommended, you know, speak to a hairdresser and take things shorter gradually throughout
Over
the
time.
treatment.
I mean, when I say over time, you might only have 12 weeks till section 2 of your treatment. So we might have to go every 3 weeks for a haircut. But what I'm saying is don't go from long and then you're going to go, right, just go over my head with the clippers on a zero, zero, which is nothing. That is not if you want to do that, I'm not saying no one, do what you feel comfortable with.
But what you're doing is giving some other options.
Yeah. I think psychologically it's not always the best idea to do that. That's.
Yeah. So we spoke about that, and then we spoke about obviously how hair grows back a different colour, and you've given some recommendations as well, which is great. I think with all of these recommendations, it's very much about working with the experts in your field. So speak to your consultant, speak to your hairdresser. But what you're saying today is you're giving some advice as to what people can do. And I think that's the bit, because some ladies are like, well, what do I do now? And
and people don't know what their options are or what is
exactly.
available or what isn't available unless somebody tells them.
Yeah, exactly. And if we're giving them the options, then they can speak to their experts and go, look, you know, can I colour my hair? You know, and ladies might go, actually, I'll go to the high street chemist and get a box set, or I'm going to go to my hairdresser. But what I think is lovely is you've said that there are options, and that's the bit, because
there's always an option. It's just problem solving. That's all it is.
And it's then about just speak to the experts. Speak to the experts about what you can do for your own specific situation. So ladies don't have to then, I think what for me is ladies then don't have to go, I'm grey now and that's it. Because that was the biggest thing, you know, ladies were like, well, I'm grey now, you know, now I feel 10 times older than before. And that's the bit.
And if somebody likes being grey, that's okay, because in the last episode I spoke about having a glossing put on your hair. You can have the glossing and look like Claudia Winkleman with grey hair, not dark hair, but you can have the shine if you want to embrace that and you like it. Go for it.
Because I've always said it, you know, a bit like style as well. When people first meet you, if you've, I don't know, say you hadn't seen somebody for a while and you've gone through treatment and you come out the other side and your hair's shorter and it's grey, if someone's never met you before, they don't know you any different. It's a bit like style, you know, it's a bit like if somebody suddenly sees you in a bright pink dress, they'll go, that's a nice dress. But you might be sitting there thinking, well, I've never worn this pink dress before. So it's all about the confidence side of it.
Yeah.
And I love the fact of the hints and tips you gave of products that can help. I know it sounds silly, but tame. One lady said to me, how do I tame this? She said, it's fuzzy. etc. And I think, you know, where you were saying about the shea butter and the other 3 products and things like that, to help stimulate hair growth, I think this
and
is...
embrace what you're going through at the minute. Because if your hair comes back curly, when you get a bit of length on it, you'll be able to put the straighteners over it and straighten it if you really want it straight again. But embrace what you have. And the other thing I haven't mentioned is, as well as working with Lisa and I, or your hairstylist and whoever you feel confident talking about your clothes with, you may want to invest in maybe speaking to like a life coach or a counsellor. Not loads of sessions, but just a couple, because it's mental, it's physical, it's your hair, it's your look, it's the whole package. So, people might say, oh, I feel really different. Lisa and I can help you externally, but to help how you feel internally, speaking to a life coach or some form of therapist that you feel comfortable talking to is always a great way to kind of push through that situation you're going through.
Yeah, and do you know what? That, I think, was the complete privilege for me to be able to work with Look Good, Feel Better, was to create and develop these workshops that we can take face-to-face, because they're already an online arm, but the face-to-face is unbelievable, because we were able to take clothes in, we were able to take, different colours in, different shapes in, and that type of thing. And listen, they're pilot sessions. They're gonna adapt, they're gonna evolve, they're gonna change, they're going to deliver what we know the ladies really want and that support and help them. From Look Good Feel Better's charity, they have amazing face-to-face makeup workshops, which are just unbelievable. So the fact that we've got the makeup and the skincare and then the face-to-face style workshops to bring this podcast today, which is all about hair, was another major thing that ladies spoke about, which to give the hints and tips. So to bring the podcast to a close, what I'm going to do, I will, for the ladies, I'm going to put it in the show notes, the products that you spoke about.
Yeah.
I will also liaise with you, maybe give me a couple of recommendations about the shea butter, that type of thing. Just if ladies want to go and have a look in the high street and things like that, because things like that we can do.
Yeah.
But I really appreciate you coming today, because it is such a huge topic to be able just to share your knowledge and your wisdom that could help ladies throughout their treatment. I think is brilliant. So I do appreciate it.
That's all right, Lisa. You're very welcome.
So for everyone who has listened, I hope you've been able to take something away with you. As we've said before, I'll put it all in the show notes. There's some links to the vitamins. There'll be links to the products that Lauren has mentioned. But I really hope it's helped. Thank you so much for listening. Please come back next week for another episode. But this is a special episode. This is a Look Good, Feel Better and Lauren and myself podcast, all about hair throughout your cancer journey. So I really hope you found it useful. Lauren, thank you so much. I will speak to you again soon. Everybody have a lovely day and speak to you all again soon. Bye-bye.